Good Wednesday afternoon, everybody. This is Adam Cooke coming to you once again on behalf of Telile Community Television, providing this online-only service for Telile as part of its YouTube channel. Once again, we want to thank the people of Communications Nova Scotia and the Province of Nova Scotia for allowing us to give you the COVID-19 media briefing for the province that was aired earlier this afternoon. It was simulcast on Telile Community Television, and we will be providing the audio for that as well as local analysis at the beginning and the end of the briefing. And we want to give you an update as well, too, that we expect to see in this briefing some declaration of whether the restrictions that have been in place since just before Christmas time are going to be extended beyond their review date of January the 31st. So we'll see if we're going to be keeping these same restrictions going into February. We can update you on a couple of things. First of all, on the local front, there is going to be a pickup point for rapid test kits for COVID-19 at the St. Peter's Lions Hall this coming Friday from 11 a.m. to 3 p.m. It was scheduled to happen last week, and then it wasn't able to happen. However, that pickup for rapid test kits at the St. Peter's Lions Hall will be taking place this Friday, once again, 11 a.m. to 3 p.m. We can also let you know of the latest numbers for COVID-19 here in Nova Scotia. It's been a sad time over the last few days as we have seen increased announcements of deaths from COVID-19, and we have 3 more to report today for COVID-19 in Nova Scotia, on top of the 5 that were announced on each of the last 2 days, yesterday and Monday. Since the last COVID-19 briefing just a week ago, there have been 25 members of the province that have lost their lives to COVID-19. We can also update for you that there are 91 people currently hospitalized as a result of a COVID-19 positive test. 15 of those are in the ICUs in Nova Scotia hospitals at this time. But those numbers don't tell the whole story, because there are now a combined 322 people who are in Nova Scotia hospitals for any reason connected to COVID-19. These include 100 people who were identified as positive upon arrival at the hospital, but were admitted for another medical reason, or they were admitted for COVID-19 but no longer require specialized care. And there are also 121 people who contracted COVID-19 after being admitted to a hospital here in Nova Scotia. So again, 322. The case numbers that are being recorded by Nova Scotia Public Health are slowly falling. There were as many as 1,000 just a couple of weeks ago on a daily basis being estimated to be complete. However, as of today, there are an additional 346 new lab-confirmed cases of COVID-19 here in Nova Scotia. There are now an estimated 4,353 cases overall, that's active cases. In terms of the 346 cases announced today, just to break that down for you geographically, 56 of those are here in the eastern zone, comprising Cape Breton Island and northeastern Nova Scotia, the counties of Antigonish and Guysborough to be specific. There are 35 cases in the northern zone, 91 cases in the western zone. The central zone, as has been the case for the last few weeks, leads the way with 164 cases. So there you have it, folks. Those are the preliminary figures in terms of COVID-19 in Nova Scotia on this Wednesday, January the 26th, 2022. So we're going to take you now for more details to the Nova Scotia COVID-19 media briefing held earlier today. We will hear in just a few moments from the Chief Medical Officer of Health for the province, Dr. Robert Strang. But once again, as he has so often done when he participates in these briefings, we're going to hear first from the Premier of Nova Scotia, Tim Houston.
Good afternoon, everyone. We've suffered significant loss of life since our last COVID briefing. My sincere condolences to the 16 families who have lost loved ones since that time. The impact of this wave has been obvious for all to see. We all know people that had or have COVID, and that will continue for some time. But let's talk about where we are today. So I'll touch on hospitalizations, schools, boosters, and restrictions. There are 91 Nova Scotians in hospital today with admissions related to COVID. Of this group, 15 are in the ICU. Of those in the ICU, 26.7% are unvaccinated. The average age of those in the hospital is 67. There are 2 children in hospital. My understanding is that they are being treated for non-COVID reasons. The average length of stay of a COVID patient in a Nova Scotia hospital right now is 7.3 days. Besides those admitted to hospital exclusively for COVID, we have 221 others in hospital who have COVID in addition to the reason that brought them into the hospital. This is a total of 312 Nova Scotians in hospital with COVID impacting the healthcare system. That means that in addition to the 91, the total of 312 also includes 100 patients in hospital who were admitted for other reasons, other issues, but were discovered to have COVID on arrival at the hospital. It also includes 121 patients who were already admitted to the hospital for other reasons and have contracted the virus while they were in hospital. We know that every patient with COVID, no matter how they arrived in the hospital, requires specialized treatment and attention. So we know it's a big stress on the system. So that's kind of a summary of the current situation. We've had a lot of cases over the past month and a bit, a lot, and we've all been through a lot. But understanding where we are today and looking forward, there's still a path to loosening restrictions, but it's a path that extends past January 31st. Many things factor into the decisions around restrictions, and two of the primary considerations at this stage are, number one, the stress on the healthcare system. I've just updated you on the hospital situation, and number two, the booster program. So while the hospitalization situation has to be closely monitored, and we're all watching that very, very closely, the booster program success is something that we can all be encouraged by, and we'll talk about that. But all in all, the most restrictions will remain in place past January 31st. But there is a path forward, and it's important that we focus on that path. It's important that we focus on mental health, that we acknowledge the importance of arts, culture, sports, and physical activity, particularly for our youth. And it's important that we talk about these things, especially on today, which is Bell Let's Talk Day. So the goal that we're shooting towards, that we're working towards, is to relax some restrictions in the arts and culture, and have sports teams be able to resume full practices with no fans around February 7th, and ultimately recitals and competitions and games back by February 14th, still possibly with no fans. But these are just the goals, and we have to watch what's happening between now and then. So with the return to school, we've been very clear that school would return on a certain date, but the government had to take care of a number of things on its side to make that return happen: ventilation, masking, and stuff. So this time, the timeline is not dependent on government action so much as it's dependent on continuing the positive momentum of the booster campaign, and obviously contingent upon watching the hospitalizations and stress on the healthcare system at any given point in time. So I know Dr. Strang will have more to say on the restrictions, but that's kind of where we're at. So if we talk about the situation in our schools, Dr. Strang has been clear that life, for the time being, it won't be COVID-free, which is why it's incredibly important that each of us do what we can to reduce our contacts and to do our part to keep our communities safer. Because by doing our part, we can help achieve the goal of allowing our children to be in school. And to date, with the return to school, we have not seen any operational interruptions in our schools. Approximately 11% of teachers and staff were absent yesterday. That puts a stress on the system, but it's manageable at this point. We have seen a shortage of bus drivers over the last week and a half, and that's caused some delays, certainly, but we're in the process of onboarding more staff to try to address this particular issue. So these types of challenges were expected. We always knew that there'd be some challenges, but people are stepping up because the overwhelming number of Nova Scotians respect the importance of in-person learning. Normal school attendance is in the range of 90 to 92%. This week, average attendance has been in the range of 85%. So we know that there are students that are absent in addition to what would normally be the case. And for those students who aren't at school, they are able to receive the lessons of their class and hopefully not fall as far behind as they might have otherwise. We are completely focused on the students of this province. This is absolutely about them. And I want to thank all of those teachers and those families and those students that have reached out to me telling me how happy they are to be back. I thank you for that. We are also very happy that you are back in school. I want to talk about the boosters. I mentioned how impressed I am with the booster program. Last week I told you that the initial plan was to do in the range of 139,000 boosters in the month of January. As of yesterday, we had 255,000 booster shots in arms in January alone. And we are on track to hit 296,000 boosters in arms by the end of the month. With our pre-January doses, this means somewhere in the range of 485,000 Nova Scotians will have been boosted by the end of this month. So this is absolutely incredible. This is a testament to the team that got to work standing up the clinics. Dave, Noella, Angela, Colin, Tracy, and your entire teams. I can't thank you enough. This is also a testament to all of those healthcare workers who stepped up and pitched in to help, and to all of those eligible Nova Scotians who wanted to be part of the solution by getting their shot. Thank you to each and every one of them. In a world of all kinds of tough news, we see it all around us every day. We can stop for a moment and be proud of what has been accomplished here in Nova Scotia with boosters. There's more to be done, for sure, and the work will continue at the same pace, but we can be proud of what's been accomplished by the team, so thank you. Also on Friday, we announced that going forward, the Pfizer vaccine would be available to anyone who is eligible for their vaccination or for their booster. Up until this point, we had a limited quantity of Pfizer, and we had to save it for anyone who was under the age of 30, since Moderna was not recommended for that age group. And I know that there were some people hesitant to mix doses as well. But to each and every one of you, you can now book your Pfizer, and there are lots of appointments available across the province. Please book it. I also want to give a bit more additional information on the booster program to date. 66% of children aged 5 to 11 have one dose of the vaccine. Including those who have booked an appointment, we're at 72%. We are right up there with Newfoundland. Newfoundland's leading the country, but we are right up there with Newfoundland in terms of vaccinating our children. This is incredibly positive news. We'll be seeing second doses for this age group starting this week. For those 18 and over who are eligible, 56.9% have either had their booster or booked their shot. And I thank you for that. I'm extremely encouraged by the progress to date. We now have an abundance of appointments across the province, so we will start winding down the mass clinics that were stood up, and we will focus on more targeted programming across the province at those areas where we can get the rates up a little higher. Our pharmacies have not let us down over the last couple of years. We can't thank them enough. We're going to lean on them again. Pharmacies will be the primary source of vaccines, and they will continue to have wide access to the doses. The appointments are there. Please book your appointment. Before I turn things over to Dr. Strang, I know there's a lot of discussion. There's discussion about highway blockades possibly coming to Nova Scotia this weekend. My message to anyone planning on blockade a highway, don't do it. Just don't do it. Nova Scotians have no patience for highway blockades, and personally, many people would know I have even less. So please don't do it. Don't block our highways. Dr. Strang?
So thank you, Premier, and good afternoon, everyone. It also saddens me to acknowledge that 16 more people have died from COVID in the last week. And my deepest sympathies go to their families and loved ones. This is a very upsetting reminder that we need to continue to take Omicron seriously. The Omicron strain continues to make many people quite sick, and it lands some in hospital, and for some, unfortunately, it is deadly. While it's true that most Nova Scotians who died during this wave are primarily older people with underlying health conditions, that doesn't mean that we do not need to be cautious. Just the opposite. The elderly in our communities need to be valued and protected by the rest of us. We absolutely need to continue to be cautious about COVID, carefully balancing, limiting the spread of Omicron and the impact on our most vulnerable and healthcare system, while limiting the equally serious impacts of restrictions. But there's also reason to be optimistic at this stage, thanks to our high vaccination rates and the hard work of Nova Scotians. So the most important thing you can do to protect yourself and others is to get vaccinated with your primary series and, if eligible, your booster dose. When we look at the data, number of cases, vaccination rate, the number of people who are unvaccinated, our deaths and hospitalizations, the message is clear. The vaccines work. So here are the facts. Evidence from around the globe shows that while COVID vaccines have modest impact on stopping the spread of the Omicron variant, they are highly effective in reducing severe outcomes, including hospitalization and death. Vaccinated people are getting COVID-19. This is expected. With about 850,000 Nova Scotians fully vaccinated and a highly infectious variant, cases in vaccinated people, as well as hospitalizations and death, while relatively small compared to the number of people fully vaccinated, are inevitable. No vaccine is 100% effective. But in contrast, about 7% or just around 72,000 people who are eligible for a vaccine are not vaccinated in our province. This small group is being disproportionately impacted by Omicron, and that 7% account for 21% of hospitalizations and 30% of deaths since December 8th. And this significantly higher risk for unvaccinated people for getting severely ill or dying is being seen across the country and the world. Think of it like riding a motorcycle. If you wear a good helmet and protective clothing, you can still get hurt if you crash, but you're much less hurt than if you were wearing shorts and sandals. Being vaccinated is like wearing protective gear. Wearing a mask and keeping your distance is like driving safely and following the rules of the road. And when those around you also get vaccinated and follow the rules, it's like everyone is driving safely on the roads, minimizing the risk that you'll have an accident, and especially getting severely injured from an accident. I don't mean to simplify what is a very serious topic, but it's important that we're honest about and that Nova Scotians understand what the data is telling us. It tells us that vaccines are protecting hundreds of thousands of people in this province from being hospitalized or dying from COVID-19. It tells us that the impact of the Omicron wave would have been far worse if our vaccine coverage was low. So as you know, we're focused on getting first and second doses to children aged 5 to 11 and booster doses to those 18 and over. Like the first round of our vaccine program, there are really two phases. As the Premier's talked about, the first phase was about mass clinics and good access to get the large majority of people vaccinated as quickly as possible. And that's why we stood up mass community clinics over the past few weeks. And in January alone, almost 297,000 booster doses will have been administered or booked. That's a massive effort, and I want to thank everyone who played a part. Hundreds of people in the healthcare system, including many who had retired, and our colleagues in the federal government. We're able to start winding down clinics at the end of the month. But it's important to Nova Scotians understand that there are still plenty of appointments available, and vaccine will continue to be available in the months ahead through the IWK, pharmacies, family practices, and collaborative care practices across the province. And we'll move from large clinics to focusing our attention to more targeted community outreach to increase vaccine coverage in certain areas or groups. This is exactly what we did last year in the first round of our vaccine program. And for that second phase, those targeted approaches will start by looking at vaccine uptake numbers by community, and from there, try to understand the reasons why people in a particular group or community have not yet been vaccinated. This work is just as important as the mass clinics, but it takes more time and planning, working with community leaders and developing targeted solutions. It could mean things like dropping clinics, the use of public health mobile outreach vans, or clinics in community halls or schools. But what works best in one community may be different from others, and so we have to work community by community. Now let me talk briefly about the current COVID activity. The good news and part of our optimism is that we are past our peak for cases based on what we're seeing when we look at our PCR or lab confirmed cases. Things are start trending downwards. And we know hospitalizations come a couple of weeks after cases. So that means we're likely right within the peak of hospitalized cases now. But we're not out of this wave yet. The virus continues to have significant impacts on more vulnerable Nova Scotians, and the impacts on the health system continue to be very significant. That's why we're extending current restrictions for 2 weeks until February 14th. And I won't list what those are, as they've been in place for some time now, but I'll make 2 comments. First, keeping restrictions in place a little longer should give more time for cases to continue trending downward and to help relieve the pressure on the healthcare system. And second, we are working on a plan now to start lifting restrictions in a phased approach. We'll be monitoring cases and hospitalizations closely, and if things go well, we'll start allowing larger gathering limits and a return to sport events and games, arts and culture events and performances. And if it's possible to safely allow some things to start earlier than February 14th, we will. Before I wrap up, I want to mention a few common questions that come my way around vaccines. Everyone 18 and older is eligible for a booster dose now, as long as it's been at least 168 days after your second dose. Some people are eligible for a third dose and a booster dose. If you meet our definition for moderately to severely immune compromised, you should have 3 doses for your primary series, and then you should still get a booster dose 168 days, at least 168 days after your third dose. You can get vaccine, any dose, after you've recovered from a COVID infection. There is active discussion around national experts on the best time to wait for vaccination after infection, and more guidance is expected soon. In closing, I'd like to say we all need each other to hang on for a couple more weeks. And please, if you haven't gotten your booster or any doses of vaccine, book it now. Remaining cautious now allows optimism for all of us as we move through winter and closer to spring. It can be easy in times like this to lose hope. We all want to return to more carefree times, and we will get there. Today, of course, is Bell Let's Talk Day. It carries with it an important reminder to all of us to be mindful of our own mental wellness and the wellness of our family and friends as we continue to navigate through this pandemic. The past 2 years have had many challenges for people's mental wellness. So I encourage Nova Scotians to check in on their mental health and to reach out and have conversations with their family, friends, and colleagues. Please don't try to go it alone. Talk to someone and ask for help.
We'll now take questions from media participating by telephone. We've got quite a list to get through, so we'll do the best we can to get to everyone in the time that we have available. We'll take one question, one follow-up, starting with CBC's Jean Laroche. Go ahead, Jean.
Thanks, Heather. Good afternoon. This question is for Dr. Strang. You touched on it during your presentation, but I just want to explore something that I think has confused some people. The medical consensus seems to be that the Omicron variant produces, as you have said, less severe disease and less likelihood of death than the COVID-19 virus that we first saw in Nova Scotia in March of 2020. Given that, why are so many Nova Scotians dying from it during this wave?
It's simply because of the extent of the spread. This wave is much more infectious than any of the previous variants. So even with the vaccine in place, and we also know that along with the infectiousness that the current vaccines they're still better than no vaccine, but they have modest effect on preventing infection and therefore preventing the spread between people. But they still, so that means lots of people have been infected through this wave. And it's simply when you have, even if you have a very low risk of severe disease, and a lot of that comes from the ongoing protection of the vaccine against hospitalization and death. If you have large numbers of people infected, even a very low percentage turns into a fairly large absolute number of people. And that is what is putting the pressure on our healthcare system at this time.
Do you have a follow-up, Jean?
I do. Again, to Dr. Strang, based on the modeling, because you said we're at the peak, is there any way to estimate the number of Nova Scotians who have already contracted COVID-19?
So that's a bit of a complicated piece, because we're knowing we've shifted, and we're for a number of weeks now, where before Christmas we changed our testing strategy, so only people at greatest risk of severe disease are getting a PCR, and where we have reliable results. We do have established a process asking people to report in if they're positive by a PCR test, and that's not just so we can count those numbers. In fact, it's very important that people understand that if they're positive, they need to report it, because the health system uses that information they provide to understand if they actually meet the criteria for home monitoring or for actually some of the newer oral medications that are coming on board. So that's a bit of an aside, but those are two critically important reasons why people need to report if they are positive with a rapid test. So we are doing some work right now with our epidemiologists to use both our hospitalization data, our lab data, and possibly that rapid test data, even though we know that that's going to be very incomplete, to create some estimation of the number or percentage of Nova Scotians who will now have immunity from a combination of vaccine or infection or both.
Next, we'll go to Global's Alicia Draus. Go ahead, Alicia.
Thank you. Dr. Strang, you mentioned that more details will be coming out just in regards to timing of getting vaccinated after getting the virus, but can you give any indication of maybe how long someone should wait? And is there a difference between, first dose, second dose, and booster after recovering from the virus?
Well, the answer to the first or second part of your question is no. That it doesn't matter which dose you're eligible for. Right now, the National Advisory Committee on Immunization is saying that once you're recovered, you're okay to go get go get whatever your dose of vaccine you're eligible for. But again, the experts are looking at that, and we will have some updated guidance coming in. I expect in the next a few weeks.
Alicia, do you have a follow-up?
Yes, I do. I'm just wondering, in terms of Paxlovid, if you can give any details. I know that the province has a supply for 900 individuals. When do we expect it to start being distributed, and how best is it going to be used?
So my understanding, I'm not directly involved in that work. We have a whole therapeutics group, but my understanding from briefings of that this morning is that we've got criteria in place. We have 900, our initial allotment from the national supply is 900 courses of treatment, and we're in the process now of getting those out to specific pharmacies, and then having Nova Scotians. It's important, people have to be very early on within the first 5 days of getting symptomatic. And as people start to register, and I'll make my point again, this is one of the key reasons why it's important that people register even if they have a positive a positive rapid test at home. that they need to register so the system can then use the information to determine if they're eligible and would benefit from this new treatment. And there's other ones coming down the pipe as well. So we're very close to actually starting to implement and start to use that medication. But it's important with a limited supply. There are very specific indications for its use, and there are many interactions with other medications. So this isn't for everybody. It's going to have some impact, but it's certainly it's not the golden ticket, if you will. It's just another targeted tool in our toolbox.
Next, we'll go to CTV's Natasha Pace. Go ahead, Natasha.
Thank you. Premier, you mentioned this off the top, but just wanted to ask you again. There was obviously a protest over the weekend at the Nova Scotia-New Brunswick border. Tomorrow morning, it's expected truck drivers will be leaving Enfield for the Truckers for Freedom convoy. What is your reaction to this? Are you surprised or discouraged by these rallies and the blockades that are happening, not just in this province, but right across the country?
Yeah, I mean the blockades for sure. There's no patience, or you can't do it. You can't block a highway. I understand people have different opinions on government policy and certainly have different opinions on vaccines and mandates, but you can't block the highway. So our message is the same. Like this is a tough time for everyone, but the vaccines work. The vaccines are effective. Those that can get vaccinated should get vaccinated. That's the way. That's the path forward. The path forward does not involve blocking highways. It involves getting vaccinated.
Go ahead with your follow-up, Natasha.
Thank you. Dr. Strang, last week, British Columbia said they were starting to manage COVID-19 cases more like the common cold. That province has abandoned contact tracing, and they're reserving PCR tests for high-risk individuals. A lot of their approach sounds similar to what Nova Scotia is now doing. So I'm wondering if Nova Scotia will soon be treating COVID-19 like the common cold as well.
So I don't think we'll ever treat, that's unfortunate language. I don't, the COVID-19 is not like the common cold, and people, even if they're sick at home, they can be a lot sicker than you would normally get with a cold. However, we are on the road, like BC, to actually moving away incrementally from not only starting to lift restrictions, but also incrementally moving away from things like contact tracing. We started with schools for the reasons we've outlined, and part of moving forward in the next few weeks is also going to be, along with lifting restrictions, further moving away from contact tracing, having all contacts isolate, all those steps. You can't do it all at once. You can't just throw the door wide open. So we'll have a phased approach to lifting restrictions. We're going to continue in a stepwise manner of backing away from intensive public health, contact tracing, and ultimately moving away from testing. At some point, we get into a space where we have an approach to testing much more like influenza, where it's really only where it's clinically important to know what virus somebody has that you use testing, and then you have a certain amount of testing to help with surveillance purposes. But the majority of people, you don't need to test. We're not there yet, but that is also a direction we will incrementally move towards.
Moving along, we'll go to Stuart Peddle with the Herald. Go ahead, Stuart.
Thank you. I was wondering if there could be more clarity about the vaccine status of those who have died, whether they're fully vaxxed or boosted, or perhaps if there was underlying conditions that applied to all of them. I don't know that we've seen any particular breakdown for this particular wave.
So what I can say is we know 30% of the people who have died, 30% of the 30 individuals who have died since December 8th, so during the Omicron wave, were unvaccinated. That's out of total population or total group that represents just a little bit over 7% of the population. So again, a substantively disproportionate impact on those who remain unvaccinated, and that is consistent with what we're seeing across the country. We need people to be vaccinated to protect themselves and others, because what we're also seeing in other hospitalizations, as I said in my remarks, the people who are ending up in hospital are those who are elderly, usually with chronic multiple chronic conditions. We know that even if they have a booster, 3 doses of vaccine, they still, because of their underlying health status, aren't going to mount the most effective immune response, and therefore they rely on other people around them being immunized to give them the layers of protection necessary. That's a challenge for all of us. What are we doing to make sure we protect those in our community and our family who are more vulnerable because of underlying health conditions? Where we need to minimize the risk to them and minimize the number who are going into hospital.
Do you have a follow-up, Stuart?
I do. Wondering why no other health officials have been taking part in these briefings to discuss the deaths, in particular hospital capacities. Previously, we've had health experts take part in these briefings, but it doesn't seem to have happened since they've resumed.
I'm not sure that it's been a frequent thing. I mean, I can remember a couple times over the last 2 years where there's been other health officials, but for the most part, it's been Dr. Strang and the Premier of the province, and I'm now the third Premier that's done these with Dr. Strang. But is the question about do you need more information? There's lots of information that comes out, but these are COVID briefings. Dr. Strang's the Chief Medical Officer of the province, and I'm the Premier of the province, and as Premier and Chief Medical Officer, we should be able to answer the questions come. That's why we attend these briefings.
The Premier is correct. On a very few circumstances, we've done technical briefings, mostly around vaccine, where we wanted to dive much deeper into the rollout and the specific technical questions of vaccine programs. But I'm the lead in the Department of Health and Wellness on the COVID response, but I'm well briefed by a number of colleagues in the department and other parts of the health system before briefings, and there's lots of opportunity through our communications. I see them every day that other people in the healthcare system provide responses on details of the COVID response.
Moving on, we'll go to Keith Doucette with Canadian Press. Go ahead, Keith.
Thanks. Dr. Strang, I'm wondering if we're doing anything to look for the new BA2 variant, and if so, have we found any cases yet?
So that is just slowly emerging in other parts of the world. I have not been involved in direct conversations, but every time there's a new variant that occurs, we have a group called the Public Health Laboratory Network, which is led by the National Microbiology Lab in Winnipeg, and Nova Scotia, has our lab leads, Dr. Hatchett and others at that table. So they would be having discussions about what we need to put into place to be looking for this latest variant. It really is. It's just a subvariant of the Omicron strain. So we'd have to look at how we detect that from a lab perspective. And I'll take the opportunity of your question to say that we really don't know if there's anything significant of this other than it's a cousin of the current Omicron. And we don't know really whether it has any different characteristics and therefore any different challenges than the current Omicron strain. That will be identified over the days and weeks ahead.
Go ahead with your follow-up, Keith.
Yeah, one for the Premier. Given your comments on your thoughts about protests and blockades, especially at the border, I'm wondering what your expectations are about how any potential blockades may go. Have you actually talked to police about how to handle it, and were you satisfied with the way it was handled, the blockade that we had, I think it was last spring?
Obviously, I don't give direction to the police on how to uphold the laws, but I think there's lots of discussions back and forth about what may happen, what could happen, and I have complete confidence in law enforcement that they'll handle it appropriately. My personal beliefs are well known. You can't block the highway. You just can't do it. But I have great confidence in the law enforcement in this province.
Next, we'll go to Adrien Blanc with Radio-Canada. Go ahead, Adrien.
Thank you. Dr. Strang, you mentioned details about the targeting programming for vaccination. And do you know if communities can reach out to public health to request more drop-in vaccination, for example?
No, the process is, and we've been doing this led by Nova Scotia Public Health since last spring, where we can look at our vaccine coverage rates by very small geographic areas, community health network areas, and then we identify where there are areas that may need some extra supports because they're lagging behind in terms of vaccine uptake, and then what we do is we then reach out to community leaders within those communities, and it can be a geographic community or a subset of the overall population from a community perspective. And then we will work closely with those community leaders because you have to, it's not, we know that we have made vaccines very accessible. So there's it's more complicated than just increasing access to vaccination. So, and one community has different factors than another community. So we need to work with communities to understand, well, what are the reasons why people may not be willing to come forward to get vaccinated? And what are the solutions that are going to be effective? So that's why it takes time, but it worked. We did this for a number of months, and we were leading. At the end of the day, when we got into last fall, we were leading right up there at the top of the country in terms of our overall vaccine coverage rates. So we know that this kind of approach works. It has worked through the fall, even for as early as late as December, where we were using this to even start to get into booster coverage in 5 to 11-year-olds. This more targeted approach does work, but it requires public health identifying the communities with our data and then building, working with community leaders to create effective solutions.
Do you have a follow-up, Adrian?
Yes, I wanted to know where we are at in the Omicron wave in Nova Scotia and why wait a few more weeks to lift some restrictions.
So, as I said in my remarks, we are looking now, if you look at the epidemiologic curve based on our lab data, we are past the peak. But we know that there's a 2 to 3 week lag, and we're right now, we're right in the middle of the peak for hospitalizations. Our health system, both hospitals and long-term care facilities are under extreme stress and pressure. We need to give them a couple more weeks of the impact of the restrictions in helping continue to slow down the spread. They need more time before we can safely start to lift restrictions.
Moving along, we'll go to Paul Bacon with allnovascotia.com. Go ahead, Paul.
Thank you. Premier, for several weeks, your government has been talking about possibly giving more support to businesses. With news that restrictions are being extended, are they going to get some more help?
Well, we'll talk to the minister. I know the minister is having ongoing discussions with different industries, but our general philosophy was we continued on a lot of the support that was in place from prior waves, added to it in some cases, but the support that's been available is no less than what was in the past, and it's generally more in some situations. But we'll continue to monitor it and see what we can do. But I mean, as Dr. Strang has said, the light is there at the end of the tunnel. So I want to thank all those small business owners and everyone else across this province who's been through a lot, for sure. But we're getting there. We'll do what we can to support, and we'll continue to monitor what's necessary and what's possible.
Go ahead with your follow-up, Paul.
Premier, when you were in opposition, you criticized the Liberals for not showing urgency on this matter. What would you say to businesses who feel like they need help urgently now?
I would say that to look at those programs. There's an extensive array of programs there. I wouldn't want to leave anyone with the impression that there's nothing being done. There's lots being done. There's always a call for more. There's lots of things go across my desk every single day that are looking for more. But the government can't do everything, even when we want to. But I would say to those Nova Scotians, there are lots of programs in place. There are programs that were in place from before that were reactivated very quickly. Some cases added to. Look, everyone is feeling this wave. Everyone has felt every wave, and as government, we'll always look and see if we can do more. But I never want to discount the fact that government is doing a lot already.
Next, we'll go to the examiners, Tim Bousquet. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, we're a week and a half into school being in person, and you've always said, and I think the numbers bear out, that the children themselves aren't at great risk, although we're hearing of lots of cases among children. But are you concerned that there may be a sort of echo in terms of hospitalizations as these children go home and interact with their more at-risk housemates, elderly parents, grandparents, that sort of thing?
There certainly is that is a potential. I don't believe it's a huge risk, and that's why we've said all along it's not just schools. Right now, that if kids are out and about, or anybody's out and about, whether it's at school, work, or other, shopping, whatever, you're out and about in the public, you're at a risk of being exposed. And so that's why it's important that everybody follow the public health measures. And if there are people in your life who are at increased risk because of age or underlying chronic conditions, then it's not just because you've been in school, that the people who are around them need to be very careful, starting with making sure that they themselves are vaccinated to build that extra layer of protection around the individual, following careful requirements around masking, all those kind of things. So each of us should have an awareness of who in our lives that we're in contact with may be at increased risk, and then therefore be especially careful around following the public health measures around those individuals. It's not just specific to school.
Tim, do you have a follow-up?
I do. Lots and lots of people have asked me about the 12 to 17 age group. By my math, at least the very earliest of them would have been otherwise eligible for booster shots last week. Is there a plan to open up booster appointments to that age group soon?
Right now, there's been no, first of all, the vaccines are not licensed for this age group for boosters, and there's been no recommendations about giving them boosters, other than for people who are immune compromised. So right now, the vaccines are licensed for people 18 plus for boosters, and we're doing that. If that changes for the younger age groups, we will follow both Health Canada regulatory approval and then NACI recommendations.
Moving along, we'll go to Lindsay Armstrong with the Coast.
Thank you so much. A question for Dr. Strang and the Premier. With about 25 deaths in the last 2 weeks, are you still confident in the current level of public health protection in place?
Yes, I am. If you look at it, unfortunate, 30 deaths are I don't mean to diminish them at all. Those are 30 people and 30 families. But if you look at the many thousands and thousands of people have been infected, the risk of somebody dying, the case fatality rate, as the technical term, is extremely low. However, so we have a good set of measures in place, starting with vaccination, which has kept that case fatality rate extremely low. But again, what I take from the ongoing, the deaths that we're still continuing to see, it's why I use the words, we have to remain cautious for the next few weeks. There's optimism, but there's also, we have to continue to hold our restrictions, continue everybody following the public health measures, continue to make progress in vaccination for the next few weeks ahead to minimize the risk of any future deaths.
Go ahead with your follow-up, Lindsay.
Thank you very much. And Dr. Strang, there's an estimated 4,250 active COVID cases. I'm wondering if this tally includes reported positive results from rapid tests, or if this is just from PCR results. And if it is just PCR, how much more would this sort of number be if it covered them both?
So that is just based on PCR results. We have just started that support to report program for people to report in their rapid test results. I don't think we have, that's one of the things I talked about earlier. We're looking at the epidemiologist, and it's fairly sophisticated epidemiology, knowing that the reporting of the rapid results is incomplete at best, and there may be a lot of duplicates, the same person reporting, and we don't know what the total population that they're reporting from, what we call the denominator. So there's a number of factors that you have to have some sophisticated epidemiology, along with vaccination rates, hospitalization rates, and our lab results to make some estimate of the total number of Nova Scotians who may have been infected during the Omicron wave.
Next, we'll go to Amherst News and Daryl Cole.
Yes, my question's for the Premier. You sort of already answered this, but I know last June when we had the first major blockade of the border, caused a lot of disruption and angst amongst people in the Amherst area. If a blockade happens this weekend, I guess what message would you have to those people in Amherst who are concerned about what may or may not happen on the highway this weekend?
Yeah, the ramifications of the blockade were certainly felt in the Amherst region, but they're felt far and wide with medical supply delivery being impeded, the movement of healthcare professionals, movement of product. They're felt far and wide. So the message is that we don't tolerate the blockades of our highway, and we have great faith in the law enforcement to make sure the traffic continues to flow.
Go ahead with your follow-up, Daryl.
No, I don't have a follow-up. Thank you.
Great. We'll have time for one more. We'll go to the Laker with Pat Healy. Go ahead, Pat.
Hi. Question for Dr. Strang. Now that so many more Nova Scotians have had COVID, what should they do when they are in close contact with someone newly infected? Is there a period of immunity?
Yeah, and so we're saying people, if you've been infected, all the science data would say that you have immunity due to that infection probably for about 3 weeks or 90 days. And it doesn't last longer than that. So there's two things. If people who have within that 90-day period, if they have been exposed, and they can consider themselves that they're not close contacts because they're not really at risk of being infected in that 90-day period. But it's also important that they take the opportunity of getting back completing completing their vaccine series, because it's the vaccines that will give them that longer lasting immunity well beyond the 90 days.
Do you have a follow-up, Pat?
Yes, I do. Dr. Strang or Premier Houston, will the booster shot become part of the proof of vaccination for people to get served at, say, restaurants or businesses that require the proof of vaccination for service?
So I can answer that and start to answer anyway. We're not looking at that right now. We're focused on looking at how we start to incrementally lift our restrictions, and that would include looking at when we might be able to move away from a proof of vaccine policy as we enter into a phase of living with COVID, and part of that would be not requiring proof of vaccination. So it doesn't make a lot of sense to add to that for a very short period of time when we're hopeful to be able to start to move away from that in the near future.
And that's all the time we have for questions today. Premier?
Thank you, Heather. Thank you, Dr. Strang. Thank you to Nova Scotians, young and old, for doing your part. Thank you for getting vaccinated. Thank you for getting your children vaccinated. You are doing your part to protect our most vulnerable and help us get back to a place where we can see our friends and family and return to normal. So thank you for everything you're doing. And just as a note, if things continue at this pace, we'll be back for a briefing in 2 weeks. So at this pace, we won't have a briefing scheduled for next week, but we do one in 2 weeks, and we'll see you then. Thank you.
So there you have it, ladies and gentlemen. That was the COVID-19 media briefing for the Province of Nova Scotia for this Wednesday, January the 26th, 2022. A big takeaway from this particular briefing is that the restrictions put in place for gathering limits across Nova Scotia just before Christmas are going to stay in effect until Valentine's Day. That's right, February the 14th, now the cutoff date being circled on the calendars in terms of potential loosening of restrictions for everything from gathering limits at households to public gathering limits in places like restaurants, retail stores, licensed establishments, salons, gyms, schools, as well as sports and arts and culture activities. Although you heard Premier Houston and Dr. Strang in that particular briefing saying that there could be a loosening of those particular sectors, specifically practices for sports and rehearsals for arts and culture gatherings coming up in February, and that restrictions on various items could be loosened before the current deadline of February the 14th. So we'll see what happens there. Curious to see as well that there will not be a COVID-19 briefing coming up next week. It'll be 2 weeks from today, so interesting to see whether that plays out in terms of Dr. Strang's confidence that the Omicron wave has crested and that the numbers are going to be on their way down. Just quickly as well, we can tell you that community vaccination clinics across Nova Scotia are closing over the next few days. Here in the Telile Community Television coverage area, the ones that are likely to impact us the most are the ones in Sydney, closing on Friday, January the 28th, and as well the clinic in Antigonish is going to be closing tomorrow, January the 27th. For our viewers around the province, or for people who have friends and family around the province, we can also tell you that the Amherst and Halifax clinics are closing tomorrow. On Friday, in addition to Sydney, the Berwick, Digby, New Glasgow, Truro, and Yarmouth community clinics are going to be shutting down. And on February the 4th, the Dartmouth Community Vaccination Clinic is going to be shut down as well. Dr. Strang and Public Health feeling that pharmacies and other medical operations are going to be able to handle the rest of the booster shot vaccinations from here on in. Over 400,000 Nova Scotians having received the booster shot over the past few weeks. We can tell you as well in terms of community efforts to stop the spread of COVID-19, the St. Peter's Lions Club is going to be hosting a rapid test pickup clinic. That's happening Friday, and it's going to take place from 11 a.m. to 3 p.m. Again, that happening Friday, this coming Friday, January the 28th, at the St. Peter's Lions Hall from 11 a.m. to 3 p.m. This one was postponed from last week. We can let you know as well in terms of the actual numbers for COVID-19 in Nova Scotia right now. 91 people having been admitted to hospital for COVID-19 reasons. 15 of those in the intensive care units right now. A combined 312 Nova Scotians in hospital for anything connected to COVID-19 right now. Sadly, we are reporting 3 more COVID-19 deaths today. That wraps up 13 deaths since the start of the week and 30 since the start of 2022. So 30 COVID-19 deaths in Nova Scotia during the month of January. As always, we welcome any questions or concerns you might have about our coverage of COVID-19 or any questions you have about any stage of the pandemic, including what could be done in terms of vaccination or rapid testing, and in terms of what restrictions are in effect. There are a couple of websites you can visit, novascotia.ca/coronavirus and nshealth.ca. But you can contact us right here at Telile Community Television as well. You can get in touch with me directly. My phone number is 902-625-8863. And you can reach me by email using the address adamjrcook, cook with an E, @gmail.com. You can also contact Telile Community Television directly. The station phone number in Arishat is 902-226-1928. And the best email address to use is info@telile.tv. A reminder that until January 31st at the earliest, appointments and visits to Telile's station in Arishat are by appointment only. You have to call ahead first. But by the same token, we want to let you know that the Community TV Bingo is going to continue at Telile Community Television, including the one being broadcast tonight, Wednesday, January the 26th, 2022. So that wraps up all the details from the COVID-19 media briefing for Nova Scotia. Thank you very much for joining me on Telile Community Television's YouTube channel. We will continue to provide local analysis of the COVID-19 briefings, and of course they will be simulcast on Telile Community Television as they occur. I'm Adam Cooke. Stay safe, get tested, be vaccinated, and we look forward to seeing you all again very soon. Bye for now.